Do you know what an orphan disease is? And no, it's not a disease found in orphanages. But if you don't know, it's okay, most of the population doesn't either. But let me tell you, an orphan disease is another word for an extremely rare chronic disease, one that is low prevalence, affecting fewer than 1 in 2,000 people. However, there are over 7,000 of these rare diseases. In Canada alone, there's an estimated 1 in 12 people who suffer from any of the 7,000 orphan diseases. If you do the math, that's an astonishing 2,961,700 sufferers living with one of these diseases. Clearly, that's not enough suffering people to qualify as a real problem in our healthcare system. The low prevalence for each of those 7,000 diseases directly correlates with the amount of government support and the amount of research and funding allocated towards their treatment. As a result, orphan disease sufferers tend to be marginalized in our society. Now that is a problem. Not necessarily the disease, but the fact that it is not considered important enough to have sufficient research awareness and social support provided by the healthcare system. The insufficient research and funding is due to a lack of interest from pharmaceutical companies who don't care because they are not getting enough bang for their buck. Does that fit your definition of a nation that values equality for all? Look at it this way. If it isn't profitable to have a school in a third world country, but does that mean their citizens don't deserve an education? In the grand scheme of things, people suffering with an orphan disease are not given as much acknowledgement as those living with more common diseases. Equality at its finest. Let me tell you about the journey of a little boy struggling with a rare disease.
One day, a beautiful baby boy is born. Carl is his name. Everyone's happy until one day Carl starts to feel sick. So they go see Dr. Lupert, who runs all kinds of tests on little Carl. Dr. Lupert says, after analyzing the results, we do not know what the disease is. However, here is a prescription to help with the symptoms. So little Carl starts taking the medicine. For the next 4 years, there's still no answers. The doctors are still experimenting with what could be wrong with Carl, and his conditions have gotten worse. He's asked about his illness every single day. He's particularly questioned by the kids at school. Why do you look like that? Carl doesn't know what to say. Carl and his parents try to search for answers, but no one's able to do anything to help. Without any awareness about his disease, he's left to feel like an outsider at the age of 4. Now 10 years have passed, and Dr. Lupert returns to say, after searching for the cause of the disease, I only came across one study done in Europe, and in that study, they found a drug to treat it, and I could prescribe it to you. So Carl and his family go to many pharmacies in search of the drug. After countless attempts in Canada, the answer is always the same. Such a drug is not available in our country. So his parents tried other countries and were able to find the drug in a European nation. So they travel to Europe. Now, when they do find the drugs, they learn that the prices are astonishingly high. Now, unfortunately, Carl's parents are not rich CEOs of Walmart, so they can't afford it. Sad and discouraged, Carl and his family return to Canada, dreaming of a day when Canada will be able to provide its citizens with the drugs they need. Now forced to live with his rare disease, Carl looks for social support. But everywhere Carl looks to find support, all he's able to find is support for major diseases like breast cancer and heart disease. Sadly, there's nothing there for him. So, sad and alone, Carl turns to social media. And in the deepest bowels of the internet, Carl finds a friend named Mark, who also suffers from a rare disease for which treatment has not been found. Together, they feel less alone. Sadly for him, Mark's disease takes its toll. Now there goes Carl's one and only support. He's now left with no treatment, no cure, no friends, and no answers. Sadly, this is the case for many.